So, Amanda McGlynn, it's the 21st of July, and I'm presenting a 40-minute presentation on Aseptic Technique Bundle of Care. Okay. Aseptic Technique Bundle of Care came out in a revised edition in March this year. Competency for all Murrumbidgee staff to get signed off. Okay? I want to acknowledge the country. I want to pay respect and acknowledge the traditional custodians of the land on which we are here today, which is the Wiradjuri country. I pay respect to elders, and past and present, and extend respect to any Aboriginal people here today. Okay, bit of housekeeping. Learning objectives we're going to cover. Quick review of some summary and pre-reading that you've all done through your online learning, plus the packages that I've sent out to you. I've got a quick presentation with some videos. I've got some short answer questions, which if we don't have time in class, I'll get you to take away, fill in and get back to me before our next session. I'm going to demonstrate the technique. You're going to have a quick practical play. We'll recap and talk about where we go from here. Okay, why are you here? Let's think about it. Think back to your pre-learning material. As I just explained, it's a core competency as a nurse of Murrumbidgee that you are signed off. And what do you hope to get out of today? Anyone?
Competency and
yes,
performing aseptic technique and doing things.
Beautiful. Thanks, Mackenzie. Housekeeping, fire, out the door, down the corridor, around to the fire escape gun site. Privacy and confidentiality, what's said in the room stays in the room, nothing goes out, so don't feel stupid. COVID has changed this week. Obviously, we're all wearing masks in this particular environment today, so just sort of maintain social distancing. We're not going to be on top of each other, which is why you're all sort of separated. Toilets are outside to the left. Work health and safety, we all work here, so we know work health and safety. Just be aware of cords and things. Respecting anyone's cultural diversities in the room, and also in our next package we will have some sharps that we will be using, so just making yourself aware of the sharps policy and what we do with sharps, because I'm not going to recover that in the next session. Our learning objectives: define aseptic technique. We are going to then explain the importance of the aseptic technique, list the essential components of the aseptic technique, identify some of the procedures that require them, that are within your scope of practice and that you feel you would use aseptic technique for. We're going to apply those principles in your work setting down the track. This is the training, then we go out in the work and we do it. And then we're going to have a bit of a practice, like I said. Don't be frightened. Remember what stays in the room? Said in the room stays in the room. Okay. So the definition of aseptic technique is it's a procedure used to prevent the spread of infection. It aims to prevent those nasty little microorganisms on people's hands, surfaces, and equipment from being introduced into some of those susceptible sites, whether it be wounds, whether it be a puncture site that we're about to do, whether it be putting a catheter in, where we're doing something and inserting something foreignly into someone. The aseptic technique means that we use the practices and procedures to prevent contamination from those pathogens. It involves applying some strict rules to minimise the risk of infection, which is why we'll talk about sequencing later. I have given you all a handout on keywords that are used with definitions, so that when you go to refer back, you'll have those key definitions. Okay, so the importance of the aseptic technique is basically to protect your patients. We want to protect them from all those contaminated pathogens. We want to make sure that they're not getting an infection from us while we are doing a medical or a nursing procedure. Good aseptic technique and the procedure of doing it actually prevents and helps control the rate of HAIs, which is your healthcare associated infections, which we do monitor We do statistics on every month. We look at where those areas may be occurring. We look at how we can improve those. And on average, 200,000 patients actually acquire a HAI in Australian hospitals every year. So that then leads to extended stay in hospital, pain for the patients, reduced quality of life. It could be something that starts out small and ends out as a chronic thing that goes on for years and years and years. Increased personal costs, they might have to have more time off work. And not just the personal costs, but you think about an extra 10-day stay in hospital, the increased cost to healthcare in general. And also morbidity and mortality. You know, the elderly people, we're increasing the risk of them possibly dying from a sepsis that we started out as a simple, you know, toe infection that we didn't actually do the right thing for. So, the principles of aseptic technique is that we have a sequence of tasks, a very laid out sequence that we follow to reduce those risks. That sequence shouldn't change, because then, you know, if you go to change something, there's always the risk that you're going to do something wrong, miss a step. So sequencing is very important. You want to control the environment as best as you can in a hospital setting. Very different for people doing wounds out in community care. You know, they're doing dressings in the home. Lord help them all. In a hospital setting, we can remove a lot of those environmental things. We can remove the food table. We can remove the bed. There's lots of things that we can do. Performing hand hygiene, which is something I taught recently, following those 5 moments of hand hygiene. Using your PPE, which we won't do this session because we're not going to go that far, but we will talk about it in the next session. And also maintaining that aseptic field. So, oops, I touched that, I'll keep going. Nah, not a good plan. General guidelines I have written out for you. There's a general guideline sheet there for you, which basically lays out the sequencing that you will need to do to perform the task. It's very simple. I have made it very simple, so it's easy to follow. We will work through that when we do our practical in just a little while. What I have now is a video to display to you, and then for you guys to get back to me and just put your hand and go, yeah, that's wrong, or yes, that was wrong. It's quite a funny video because things are so obvious that they're doing them wrong. So I'm just kind of duck in here for a minute and just end that for a second. I'm going to zoom that down. This is all new to me. So it's actually just a YouTube, you know, what are we doing wrong? How we clean a wound. That looks like a femoral.
Do you want feedback as we
We'll
go
talk about it.
along?
So that looks to me like a femoral artery.
Let's just push
Okay.
the hands all over it.
Yeah.
And just throw it on the patient or package. Where's your
I'm happy for you to
dressing
talk
table?
while I was going to discuss issues. Does she even have an aseptic field?
Nothing. Nothing. How funny. She's got this stuff. Yeah. Yeah, she stretched her nose with a mask while she was giving a speech to us all. That was lovely.
I just put it on.
So over bubbles. Or was it eye actually? Was it eye actually? Oh, I don't think that was good. And the glass.
She needs to be about sequencing
Does she have a process that she follows, or is she just willy-nilly throwing
She's
shit up
winging
there?
it. She's winging it.
Yeah.
That mask is not COVID safe.
She must be good in the COVID room.
I highly doubt whether she's even protecting herself,
Yeah.
let alone the patient.
Yeah,
Well,
correct.
she's got enough gloves on.
Well, she hasn't got a, I don't think that shield's on her.
She's actually touching the underside of that
Yeah,
dressing.
she's
She's
done
just
that
putting
twice.
on just so
Yeah.
you pick up.
What is she doing there? What
She's
is
wiping and dressing and pulling that out, so she's got pressure. We don't use those here, obviously. We just put direct pressure, but that is what she's doing.
Yeah, I've never seen that.
So we apply pressure to the femoral. They've got a device, so they don't have to step there.
It's like a clamp.
Correct.
Oh my god.
She needs to wash her hair. She needs to wash her hair. Go to the hairdresser's love.
It's always the way, as soon as you got your gloves on, your nose gets itchy.
Yeah, it is. Oh, you start sweating.
Yeah.
Correct.
Poor lady, she just needed someone to help her.
Okay.
Yeah, well that's, yeah.
Sorry, and
She just had a lady there who was actually just
laughing at her.
and videoing her instead of her doing what she needed to do. But anyway, quite a funny little video. So the first thing that you picked up on might have been,
When she dropped the glove and picked it up.
I can
Yeah.
actually,
Did she wash her hands first?
yeah, she did.
the.
So she did wash her hands,
She
but
did, I didn't see that.
what is the rule with washing your hands?
The
Before you put-
20 seconds.
Correct. Did
Let it
she
dry.
wait? Yes. Did she wait the time frame before she put the gloves on
No.
for the hands to dry?
No, she,
Okay, so there's our first breach of hand hygiene. The second one, definitely whoever said gloves on the floor is just makes my skin crawl. Next one, just off the top, they don't have to be in order now. Those were the two I could remember from the beginning.
Like Max said, when she cleaned, instead of going from in to out, she went from out to in. So
Beautiful.
she's just spreading it all back
Yeah,
in.
so
no,
all wounds.
No trolley.
No trolley,
Yeah,
wasn't
everything,
even a septic
everywhere,
field.
everything.
Correct. Did she have a designated area?
No.
no.
The
The
patient.
patient.
Everybody passed the patient.
Bed sheets, yeah.
It looked fairly willy-nilly to me to grab something off here,
Yeah.
I'll open that.
There was
and
no
I-
sequencing. She didn't have the trolley ready and then get everything and do a PPE. She was
Yeah.
just doing it all
Yeah, the sequence.
mishmash and then went to the
Oh.
computer and
Putting on her PPE, donning and duffing.
When we put on PPE, there is that sequencing. And as you all know, with COVID around, that sequencing has become very strict. And that's to reduce our risk of catching infection. The way in which we put things on, there's a reason that we do it in the sequence that we do. And that is to reduce that risk of us getting the infection. And this is from our point of view, not patients getting infections. So when you're dealing with a patient and you're the one doing it, that sequencing is so important to ensure that that patient doesn't get, and that's why we've done up this simple follow task, that can help you guys have that sequencing, know it, and then you won't even have to think about it. It becomes second nature after a while to not even, have to think about what you're doing. It just happens. Scratching your nose, scratching your hair, putting your glasses on after the event. I didn't quite see whether she had any jewellery on her arms. Our bare below the elbow policy is one thing that actually comes into this to make sure that you are bare below the elbow. Now, anyone wearing medical alert bracelets are actually allowed to wear them to work. It is okay to do so. But if you're doing an aseptic technique, you should be taking that bracelet off before you progress. Even people with wedding rings, we are allowed to wear them to work, plain, but I do still push you to take them off, put them in your pocket or somewhere safe, just to doubly ensure you're reducing any risk. Okay, if you drop the glove, if you scratch your nose, if you touch, I don't know, anything, start again. Okay. The second video is quite a long video, but what I will do is I'll give you guys the link, and it's actually a nurse educator doing the procedure properly. So that if you guys forget how you have to do it later on down the track, and you're not sure, you just want to re-jog your memory rather than coming and seeing someone, it's about a 40-minute video. I in my 40 minutes. Don't have time to watch that today, neither do you, but I'll provide you with that link. It's a very, very easy, she's very easy to understand. She's got a very clear process that she takes. So I do really like hers. So, see if you guys can identify some of the procedures that you may do within your scope of practice that require aseptic technique.
Wound dressings.
Beautiful,
Inserting IDCs,
beautiful.
cannulas,
Yep,
blood.
so as in your vena puncher,
Yeah.
correct. Under wounds, we not only have simple, but you may come across your complex, as in your vacs.
Surgical.
Yeah.
When you're doing your vacs and stuff, it's very important to do this because there is a lot of equipment and a lot of stuff you require to get before you even get to the patient. You get through half a dressing and you go, oh, I forgot that. You have to start your aseptic all over again if you leave. You might be kind enough to have your old mate down the corner, hey, can you go grab me something? Bit of a pain, not always doable. A lot of things, so your cannulations, we've got your central lines. So we do central lines here at times. I have seen femoral lines put in. Chetan is a big user of femoral artery stabs. When you think about it, he's got sterile gloves on.
Yeah.
So sterile gloves, cleaning the area. It is a big femoral artery. It is a big thing for infection to get into, and that's a massive source of infection. Also our arterial lines. That is why when we set up for arterial lines, that there is such a process because it needs to be. So you think about that's going straight into their massive systems. It's not going into your little ones. It's, you know, cracking it pretty big. Catheters. So not just your IDCs, but anyone who has competencies to do SPCs as well, which we do have some girls in ED who will do SPCs. So if you're ever helping as a dirty nurse, I call them, and you're doing the dirty part of that procedure, you still need to be as aseptic and be cautious of the field that that clean nurse has so that you don't then contaminate the field that she is using. Okay, so it is important even as a dirty nurse that you actually follow, and it's a terrible word, dirty nurse, I know, but when you get more skilled, you do become the clean and dirty nurse together, a two-handed thing. Not as easy when you're starting out. Then we have wound dressings, simple and complex, like I explained. Back dressings, lots of you girls in ED, suturing. So suturing not just for the doctor, which mostly some of our doctors here will do, we don't have to assist so much, but just remembering to keep that aseptic for them so that they're not introducing. And your utensils, if you're opening utensils onto a field for the doctor, ensuring that you're not contaminating the field. Okay. And also your porta-cath access and de-access once you have your competencies. Accessing all those central lines at any point in time if you're doing antibiotics. If you are putting fluids up, you need to keep that as sterile as possible.
Probably knocking off short.
And chest drain insertions, mostly ED, but definitely aseptic again. You're going into a pleural cavity space, straight into a lung, putting infection in a lung, putting an infection in wherever, you know, not a very good outcome for the patient. And your IOs for your, you know, patients that are fairly critical and we can't get lines in, should still be definitely aseptic as best to your ability. Often these, and your vena puncher, which we covered. So, what I'm going to do, I'm actually going to demonstrate to start following my guideline. Just let me know when I'm getting close. Yep. So, we go to our little storeroom and we find a dog trolley. So in hospitals, you normally have a designated trolley that you use. You don't just use the bedside table. You don't just use the end of the patient's bed. We have designated trolleys for a reason. because they're nice and clean, or can be nice and clean, they're, you know, steel and business. I'm going to get my wipes to clean. I only brought one bucket to share today. I'm going to get my dirty bag to put anything that I might be taking off something or anything I might use to put in the dirties. I then have to find something to put it to my table with, which will be tape. Please do not use dog clips when you're doing an aseptic. Dog clips are not clean. They've been to Timbuktu and back. Tape. And my dressing pack. Now, because we're not talking about doing any particular of these procedures today, all we're doing is setting up our aseptic field for the aseptic technique. Next session, we'll talk about adding things in to do cannulas, so we will have more equipment to bring in. But at this point, that's all we need. It's looking pretty easy. Hey, John. So, grabbing my wipe. I've assessed my patient, gone to the bed, I didn't follow my sequencing. Gone to the bed and gone, yep, that's my patient. Yeah, I might move that lunch and I might get rid of that old towel off the end of the bed. Is the procedure definitely necessary? So as a registered nurse and as an enrolled nurse, if you're asked to do something, is it really necessary? Do I really need to stick a needle in there and make another source of infection? Do they really need a catheter? Can we do a cannula and vena puncture at the same time so we're not doing two sources? Query the doctors. Ask them, is it really necessary? Does that dressing need taking down today? It's still intact, there's no ooze. Why am I pulling it down every day? We're inhibiting the actual healing process by pulling them off. I've got my equipment that I needed. Now, I'm going to go, well, I should really check all the packs, which I kind of looked at earlier on today to make sure that there's no breaks, it's not discoloured, etc. I'm going to go wash my hands in the sink. Aseptic technique probably should be your wash with soap, not just your alcohol rub to start with. Okay, now I am going to clean this regalia here. The field at the top here is what we are going to have as our aseptic field, nothing down below. Getting your wipes. Okay, you want to do the rails as well. Okay, because these little packets don't always land exactly where you want them to lay. I tend to do around the sides as well. Drop one on the ground. Because sometimes they do tend to flip under the rail as well. I'm gonna wipe. This is a very, very moist cloth, may I say. And then I'm going to take this and go and throw it in the bin, which is over here. I'm not going to use any of my equipment to do that dirty part. If I need a sharps container, I'm going to make sure that that sharps container is close by, but I'm not going to sit it on the top of the trolley. So that will be in our next process with cannulas, because you're going to have a sharp to actually do something with. And then you're going to go and perform some hand hygiene again. Washing, because you've just done a dirty procedure. Washing, washing, washing. Normally for me, when I come back, I would like my dirty bin set up. You can use plastic bags. Years ago when I was educated, we used brown paper bags. These days, if you have a wound that's got lots of extra date, you're probably going to want a plastic bag. Try and make sure the bag you find is a reasonable size and not the biggest bag you can find that's going to cover half your trolley. And then all you're going to do is tape this onto your trolley. Simple as best you can, do not touch it. You're only touching the tape, okay? And there is my dirty bag. In the back of my mind, I have been thinking, however, I use my left hand as my clean hand. I use my right hand as my dirty hand. Okay, so think for a second, why am I doing that? And I'm going to the patient on this side. Clean hand, dirty hand. The brown bag, which is going to be dirty, is the closest to the patient. So I'm not carrying something from here that's dirty and going over there and putting it in there. Does that make sense?
Perfect sense.
Rightio. Stepping along, we're going to open this packet. Your precious packet that I want you to keep for next time we do the session, because we're going to reuse. I'm sure New South Wales Health won't let us do too many that we're not paying for. What we're going to do is open it. In the packet, it's sterile. You're going to find the end that's easily to be opened. One end won't open, it's sealed. I'm going to take the top off and throw it in my bin. I'm going to then sit this on the top and get rid of my rubbish. Okay? It's now on there. That inside that package is now the sterile field. I'm now going to go and wash my hands again. Don't need gloves at this point. Anyway, then next we're going to do the opening of the sterile dressing pack. They never used to have these little sticky things on when I was training, so they're a little bit more difficult than just opening it out when it's folded. It does say tear and open, remembering that the outside of the pack is not going to be sterile in the end anyway. It's the inside that we're protecting. So if we're stirring the top, opens pretty easy. Remembering that, you're right John if you have to answer. Remembering that we're keeping the insides actually as sterile as sterile as you can. So if you need to pull it because it's not sitting properly, you want to pull from the very corners and underneath the very corner as much as you can. So you know the tips of those sides have been touched, but the inside middle of that is your sterile field.
Okay. Okay, no worries. All right.
At this point,
They have admitted that palliative lay is planning to go.
okay, that's fine.
That's okay.
That's okay. Yeah, I'll catch up with you though. Okay. The next thing is anything else that we need to add to this, which we'll do in the next session for any procedure. You are going to put in the middle of that field. You're not going to sit it at the sides. You want to try and get it in the middle because that's where it is absolutely the most aseptic part. Going to go and wash my hands again because if I've added any packages onto there where I've opened them, my hands are not clean because I've touched the outside of packages. Go and wash my hands again. Next, we are going to prepare the patient, reposition them, pull their covers back, do what you need to do so that you don't have to touch them again. Expose where you want to put, whether it be a dressing, whether it be a cannula, any of that. Then we are going to go and wash hands again and put on PPE if we need it. Cannulas, gloves, dressings, gloves, catheters, obviously sterile stuff. Okay. The next thing we're going to do is actually perform the procedure. So the biggest thing about this is these are called your dirty forceps now for the rest of the procedure. These can be used to pull out your drape, which you may use to put near your patient. You may pull out your sterile tongs, and you might throw some saline in there if that's what you want to use to clean a dressing. Once you don't want to use these, or you think, oh, I don't know whether I might need them again to move something, use the corner of your dressing. Keep that as your non-aseptic. If you don't need them again, I never throw them out till I'm finished because there's always something I forget or that I need to move to get it out of the way. So remembering clean hand, dirty hand. You've got your two, I'm going to do this procedure in the back of my head so you understand the aseptic field. Clean hand, dirty hand. No, clean hand, dirty hand.
Yeah.
Sorry, whichever way. I've forgotten now. Clean hand, dirty hand. I've got my swab and I'm going to wet it. Now, my clean hand is going to wash the patient as I need to, or clean the wound, whatever I need to do.
That was clean.
Oh, thank you.
You're nervous, it's okay.
If the patient wouldn't need to come around this side anyway, so.
Depends on what hand you are as well. So often people who are left-handed will go from the left side, people who are right-handed will go from the right side. So it just depends on what hand you are as well. So clean hand, dirty hand. So clean hand into the bin, dirty hand. So if I need to touch anything, as in the patient, this hand can't go back onto the patient because it's a dirty hand, right? This is your clean hand. I'm getting myself all confused now,
that's
see?
okay. Or it can't go over your dirty hand.
Well, I don't want it to go
Yeah.
over, correct. So you've got that, you're going to clean, that's your dirty, throw. Clean hand, get what you need. Dirty, wash, throw in the bin. Dressing wise, clean, hopefully you've opened all those on there because you're going to pick the dressing up with your clean hand, put it on the patient, and then fiddle it out with your clean hand. Dirty hand, get rid of anything into there. When you're finished, you can either throw them in here or you can throw them in there. Makes no difference. Cleaning up is just as simple, I believe. No longer aseptic. I tend to tie knots so that anything that's in that field is
Sharp.
correct. Well, no, not sharps, but the sharps are going to go in the sharp container.
Oh, yeah.
It's all contained in the pack.
The infection's all in there, isn't it?
Correct. Go take my PPE off that I have on. Wash my hands. Come back. If I have to set up an IMED, I'm then going to press the buttons. I'm not going to press them with dirty gloves. If you've got to set up a back dressing, you do it then. Then you go wash your hands because you've touched the patient's surrounds. Then you go and you take your trolley to wherever you need to go. You get rid of your rubbish and you clean it for the next person. Now, that might mean that you're cleaning it now, but that doesn't mean you don't clean it next time. If you go in 20 minutes and do it again, you still need to do that. Get rid of it, wash your hands. Rightio. Your turn. What I'll do is I'll give it each a wipe. You can use the front of your desk today because we're not going to go and have an aseptic table because I don't have enough to be able to do that. So the first step you're going to do is not wash the table. You're going to perform your risk assessment. Is there anything you need to move out of the way?
The table, the books.
Beautiful. Review, does what we're doing really need to be done today?
Hell yes.
Thank you. Gather your equipment. I've put them all on the table for you so you're in a great state. Right, perform your hand hygiene. Clean your trolleys. If you need a sharps, we will have that, but you don't need it right now. Perform your hand hygiene. Open that packet. Find that edge that's simple to open. There's two corners that are much easier.
The one that says pull at the corner.
Just do it like that.
You can, but see how it falls? Often not easy, which is why I would tend to, before you just throw yours down, I do like Karen. Pull it open, hold it, drop it down, so it's going to fall exactly where you want it to fall.
Not happy with this though.
Anything, sorry, that's right. Anything else you're going to get, dressing wise, whatever you're going to do, we're going to now go and get that ready.
Okay, yep.
So we don't need that. Perform your hand hygiene, then open your packet. Remembering the outside is not sterile, it's the inside. Good job, guys.
They're not how they
There's
used to
actually
be.
tabs.
There is tabs to
So
follow
much
them.
easier.
Oh, where are the tabs? Show me
They're
them.
little bitty bits, look like little
So
doodles.
remember, this side's not sterile.
Oh, well, I thought that was the inside of, I thought that was the sterile field.
There you go. See your tab?
See, I was
All that.
never to touch that either.
Yeah.
Oh,
All
I
those.
didn't want to
We're always
touch that.
doing this.
And then you've got tabs on the other side. Now, like I said, if it doesn't pull out, you can use your corners.
Well, they need to put the tabs on the outside.
Perform your hand hygiene and get your patient ready. Perform your hand hygiene. Rightio. Get onto that yellow little dirty one and pull out some bits you might want to play with.
I always get confused, is it blue, down or up?
Blue
Down.
is down.
Because that's the waterproof bit, that's how I remember.
So if you can't do that with that, put it on there, ready to go, and you can use your two blue ones to then, because they're sterile, to open it out when you need to. Remembering to put your yellow one when you're finished in a corner that you know is now not sterile. Now, clean hand, dirty, depending on whether you're left or right, I want you to pick up one from the two blues, and I want you to do the whole clean to the dirty, dirty to the bin.
So, your dirty hand would be the one that you use the most. is
Correct,
that
it's the
correct?
one you're going to use to actually touch the patient, because you
Yeah.
don't want your clean hand going back in the sterile field. Does that make sense?
Well, I'm right-handed, but I would use that as my clean and my
Yeah,
left is
yeah,
my
that's
dirty.
what
It
I
definitely
just
does
thought.
But
depend.
it's okay if you don't go back over that sterile field, so I'm like
Yes.
only right-handed.
So you're going to throw it that
And
way
I'm
to
just
that
gonna pass
bin.
it that.
As
and
long
then
as
go
when
that
you're
way.
doing it, that you're not pulling the dirty back over your sterile field, because the bin's
Yes.
on this side.
But
So you
so
need
we
to
can-
be,
We can do this first.
So I'll
yes,
pretend
you can,
that's
now if you need to
patient.
squeeze stuff out, you use the two blue ones together
But then I what?
And you're not allowed to touch the.
and
actually,
throw
that's my
with that
dirty.
hand. Throw to your bin.
Sometimes I
Alright.
just pop it
Yep,
over.
So,
Clean to
okay,
dirty.
clean, dirty.
That's what I, do. But then if you want to wring it out, it's too late.
Correct.
Yeah,
So you
you
want to
just
be
need to
doing
go
all
on
that
so
before you start, which we'll talk about in the next
You
session.
wring out.
You wring them all out ready.
Yeah.
So if you've got
So
stain on, you
right.
wring them all, have them all ready, so that when you go, you just go clean.
So I'm putting it on the patient with the clean one.
Yeah.
Or you can actually go,
Come back
you
here.
can
Go
go,
like that,
you can go
I
clean,
can touch
you
that.
can
yeah.
go clean to
and then
dirty
like
in
that.
there.
So that won't matter,
No,
that's,
as long as they
that's
don't
dirty.
touch.
Correct.
Yeah.
I tend to do it diagonal to A, diagonal, because it's the biggest space of wherever.
So dirty,
So,
Yeah, if they're all balled
Clean.
up,
clean?
you
Clean,
could go like that.
where's your patient?
yeah.
There, so that's your clean
So I
hand.
just think that
You
is
want to give it
just
to your dirty
infectious stuff.
hand in a
You
way.
put
But
it
don't
in
put it
Yeah, that's
over
my
the field, put it behind.
Oh, yeah, so
You know what I mean?
So how do you?
Clean to
What
dirty
if
field.
that dirty
Yep,
bit that you
and
put
wash,
in there
and
starts
throw.
to the wound or something?
Either there or
So
there,
have
because
it
you're not
all
going back
right,
over your
so
field.
drop
Yeah.
it on.
Okay?
Clean.
Clean, dirty, clean, dirty, clean, dirty. Sometimes
I'm
when
alright.
you're doing catheters and clean and dirty nurses don't work out real good. But as you get more confident, you'll have a clean hand and you'll have a dirty hand, and you'll work out which to use.
Yeah, I reckon.
I take my dirty hand and tuck it under like a wing,
Yes.
because, and then I remember that that's my dirty hand.
Remember, anyone playing this game when you're a kid? It's practice.
Yes,
never
It is
I
practice.
was terrible at that
I
game.
Okay.
never got the game.
Practice, 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 so you don't zap the little man. So now that we've had a bit of a play, we're just going to recap. We've covered what an aseptic technique is. We've covered the hospital-acquired infections. We've done our principles and some of the procedures that you guys would use within your work practice. I've got your glossaries. I will send you the slide so that when you need to watch someone doing it, if you've forgotten the process, that's fine. And we have our simple process. Going forward, how do you feel about it?
Oh, great, but
Better.
it does take practice.
It does.
It does, I feel better though, I like this tiny thing.
We're gonna save them.
Remembering that you do need to go out into your workplace and you do need to do some supervised. Remembering that they have to be with a senior RN or our educators, and that way you can get practice. When you feel that you're ready to sit a competency, I have attached the competency to your handout so that you know what we're looking for in that competency so that you can read through them, you sort of know what questions we might ask you, etc., etc. The next session that we're going to do is about using the aseptic technique to obtain that venous cannulas. So we'll be adding things into that field, okay? Which is where we learn about putting it in the correct field, all those sorts of things. Any questions?
That's how I should do, Kelly.
Okay. That's done.
Yes,
Oh,
yeah.
You're right?
yes.
Any questions, Kat?
No, thank you. I just like the
Only
taste
if you
like
have
that,
something that
guys.
you
Sorry,
don't
I'm being anal, but it's,
What do you want to know?
we're talking about sterile
I just
septic.
know, if
You two guys are good?
if I have the patient on that side, I just know that's my dirty hands,
Yeah.
just near the patient. I think that's easy, just put.
Yeah.
try
And sometimes it's easy to put your trolley where it is literally an assessment on where the patient is, what the position of the patient is, how you're going to get to what you need to get to, and how you're going to do it. Which is what you're going to do in that first risk assessment. Where am I going to put the trolley? I'm going to put a catheter in and I'm right-handed. If I put the stuff over here and I'm right-handed, probably not a great idea. Same as when you're setting up, you're always going to put your trolley where you want it. Same thing.
Are you not allowed to touch it next to the bed or on anything?
So anything you need to move with it from then becomes a downhill. Okay, this is sterile. Foot or hands on the lower. Okay, you're going to want to, don't touch this to move your trolley. Now not sterile. Okay, down here, I do tend to use my feet a lot in the room to push the trolley where I want it. Feet seem pretty good. That'll come with practice. Anything else? Beautiful. Can you just go and close that for me, boss? I'll see you guys in a couple of weeks for the IV cannula, using the aseptic to put the cannulas in. Just close.